Thank you, and welcome to the Child Welfare Information Technology Systems Managers and Staff webinar series brought to you on behalf of the Health and Human Services Administration for Children and Families, presented by ICF International. Today's webinar is entitled State Child Welfare Information System Mobility Projects, specifically featuring the efforts of two states, Missouri and Massachusetts. I am Joyce Rose, your host and moderator for today's webinar. For new attendees and for those who may have missed previous webinars, here's the list of the previously recorded webinars, which are posted to the link identified on the slide.
The titles for the previous webinars listed are as follows. December, From Waterfall to Agile, Understanding the Differences and Managing Cultural Impacts. January, The My SACWIS Experience, From Waterfall to Agile Development and the Promotion of a Healthy SACWIS. February, The Ups and Downs of Education Data Sharing to Benefit Children in Foster Care. March, Bridging the Partner Gap, Best Practices in Working with Courts. April, Improving Quality and Reducing Risk with IV&V and QA. May, Demystifying the Capability Maturity Model Integration, Improving Organizational Performance and Quality. June, Facts Rails, Creating Business Intelligence for West Virginia's Bureau for Children and Families. July, New Jersey's Managed by Data Program. August, Estimation for Social Services Information Systems, Lessons from the Trenches. October, Modernizing Your Child Welfare Information System Without Losing Your Sanity. You can find these webinars and more by visiting https://www.acf.hhs.gov/cb/research-data-info-systems/training.
And we are currently working on developing the webinar topics for December and for January. So, attendees are encouraged to participate in our webinar with questions and comments. All of the participant lines are muted now, but we will open them for the Q&A session at the end of the presentation. However, please be aware that you can submit questions at any time using the GoToWebinar chat feature, and those will be addressed during the Q&A session. Should we run out of time, we will respond to your questions via email, and/or should you have additional questions, you may submit those to me at the email address listed on the slide.
Joyce can be reached via email at joyce@kassets.com.
Also, if you have any topics that you would like to recommend as potential webinars, please do not hesitate to contact me. So, the Division of State Systems within the Children's Bureau continues to provide a series of monthly webinars supporting information sharing and discussion. Understanding who is attending the webinars helps to identify content that is applicable for everyone participating in an agency's CWIS efforts. Please self-select one of the 5 categories listed, and my colleague, Elizabeth, will conduct the poll. Elizabeth?
Great. Okay, so you see the categories up on the screen. I'd like you all to go ahead and choose the category that best represents you. If you are in a room with a group of attendees, if you could select a category that most represents the biggest number of people in the room, that would be great. And it looks like we have about 31% State Child Welfare Information Systems Program Managers, 62% State Child Welfare Information System Program Policy or Technical Staff, 3% Tribal Child Welfare Information Program Managers, and about 3% ACF Children's Bureau personnel. So Joyce, with that, I will turn it back over to you.
Yeah, and certainly because of the number of attendees who have registered for this webinar, it obviously is very popular and of great interest across the agency. So I'm very pleased to see a tremendous mix of. So let us go ahead and meet our participants today. We have Tomy Abraham from Massachusetts, and Tomy is the Director of Business Applications for the Massachusetts Department of Children and Families, and as such is responsible for implementing innovative computing solutions to complex human service problems. His recent endeavors include deployment and management of 6,000 mobile devices to a diverse child welfare workforce, which he is going to talk to you about. Leanne Leason has worked for the Missouri Children's Division for 22 years. In those years, she has worn many hats, including frontline supervisor, caseworker, policy writer regarding payment processes for the Children's Division, and implementer of the Missouri SACWIS, known as FACES, Statewide Help Desk. And in 2011, she became the FACES program manager for the business side. So now I would like to turn this over to Leanne to begin the presentation. Leanne?
Thank you, Joyce. I'm excited for this opportunity to share the work we've been doing here in Missouri. If we could get the first slide, please. Some of the things we'll look over today is what is FACES, which is the name of our SACWIS system here in the state of Missouri, and what led us to consider mobility. Some of the lessons learned we had from past mobility projects, what our top mobility objectives were, and some additional benefits that we found coming out of mobility that we really didn't expect. And we will end with some lessons learned from this newest project and some challenges that we have faced. Next, please. So first, what is FACES? FACES is our Family and Children Electronic System. A little bit about our technical environment. It's an internet web-based enabled system using COBOL, DB2, and CICS. Our database contains 818 tables. Our operational environment is our Missouri is state administered. We have 145 counties and offices in most of those counties. We have over 2,000 Children's Division staff, and we have 400 contracted case management staff. Next, please. How many families do we serve here in Missouri? We have currently, as of June of 2015, we have about 9,000 family-centered services cases, and those are intact families who we're providing services for. Over 20,000 children in adoption or guardianship placements, and over 13,000 children in foster care and in the custody of the Children's Division. Next. So what led us to consider mobility? We had numerous direct requests from frontline staff for mobile functionality through our state's continuous quality improvement process. Our state finds that we have a very young workforce, and they're all up on the newest technology, and they were clamoring for some of the new tools that are out there. We did have to prepare a response to an increased staff turnover that we were seeing. Over the last 3 fiscal years, we lost 500 frontline staff. That was 25% of our workforce. And as of March of 2015, 45% of our frontline staff had less than 1 year of service, and 25% had only 1 to 3 years of service. That means that 70% of our frontline workforce had less than 5 years. So we needed to look at what was causing that, what we could do to help retain staff, and address this issue. Then we wanted to look at how to make workloads more manageable and to increase effectiveness in the field. Next, please. So first we needed to look at some past attempts at mobility. Back in 2009, we had attempted a mobility project with 97 new laptops and PC internet cards. Sites were selected for a 6-month pilot. We looked to evaluate such things as worker-child visits and timely completion of child abuse neglect reports. Some of our goals were the same: increase efficiency and maintain and improve quality. Next. This is just a brief look at some of the results from that, and as you can see, our project numbers were not a whole lot better than our control group that did not have the laptops. Next. So why did this first project fail? Connectivity in the rural areas was probably the biggest factor. The PC internet cards failed to work. The laptops were considered unwieldy. Direct connection to our FACES system through VPN connection was required to be able to collect and report information. And if they were unable to get a data signal from the provider, that just wasn't possible. And we have some really rural areas in Missouri that just really struggle to get a data signal in those areas. So the outcomes didn't support to continue funding these data cards. Next, please. So when we sat down to look at a new mobile solution, we had 4 really basic top requirements. We wanted staff to be able to enter and save data into a secure app that would not require Wi-Fi or cell signals. Once in range of Wi-Fi or cell signal, to be able to submit saved data directly back to the FACES system. We wanted to be able to have access to their work email and calendar, and the ability to perform child abuse, neglect, prior history searches while out in the field. Next. So what was our approach? We selected the iPad Air as our mobile tool, our mobile device management solution with Mobile Iron, which granted access to full work email and calendar. Statewide frontline staff in a work group identified 4 initial areas of our FACES system that they wanted developed into this mobile app. And we asked them, if you looked in our whole FACES system, what are 4 areas that you would want to have available to you while you're out in the field? Because not everything we do is something you would need to have while you're out mobile and working with families. So they identified 4 specific areas. One was the safety assessment, which is to initially assure safety of children within 72 hours of a hotline call. Visitation. This is where our frontline staff document supervised visits between parents and children who are in foster care. Contacts, documenting all contacts staff have with case members during the life of a case. And then what we call our participant and individual screen. This gathers characteristics unique to each household member on a case during a hotline investigation. Next. So our IT staff, and I'm proud to say we did develop this in-house with our state IT staff, they developed a FACES mobile app that mirrored these 4 identified areas of FACES. Initially, staff must have Wi-Fi or a cell signal to download the case to the iPad and the mobile app. Downloaded cases can be reviewed in one of those 4 areas without connectivity. So once they have the case downloaded to the app, they can go out in the field and work in the FACES app in those 4 areas without having to worry about Wi-Fi or a data signal. Once they're ready to send the information back to FACES, they do have to be within range of Wi-Fi or a cell signal again. But then it will be synced back to the FACES system for them to view later. Next.
A screenshot appears with an image of the login screen from the app.
So just a really brief look at one of our screens that we have, some of the apps that we have for safety assessment. We do require all of our staff to enter their credentials and passwords before they can enter the app. Next.
A screenshot appears with the app's data fields for call case number and case function type.
The top box shows where they would enter the call or case number to download the case and then select the functional area in which that case applies to, whether it be our investigation and assessment or our family-centered services cases. Next. Next, please. Once the case is downloaded to the app, they have the option to either delete the case off the app or press Add Safety Assessment, which will then bring them into the screen that has all the information they need to add the safety assessment. Again, the screen looks very similar to what they would see if they were sitting at their desktop workstation logged into FACES directly. So they can enter and answer the questions regarding whether the child is safe or unsafe. Next, please. And then at the end, they can have options to delete, cancel, submit, or save. They are required to save any information first before they are able to submit it back to FACES. And again, they have to have Wi-Fi connectivity or data signal to upload the case to the app and then later to sync at the end. But in the middle, while they're entering the safety assessment and saving it, they do not need to have any kind of signal. Next. So in order for staff to perform child abuse, neglect, prior history searches, which is one of our 4th requirements, all staff were transitioned to virtual desktop. We are in the process of still doing that, but a lot of staff have been since transitioned to that. This allows them a secure tunnel with dual authentication into the network from their iPad to their desktop and full FACES. It allows them to access and perform the needed background checks. It is dependent on Wi-Fi or cell signal for a connection, but this has been a really useful tool for staff while they're out in the field. They're able to log in as if they're sitting at their desk, and they can actually get into the full entire FACES system to do background checks and even work in other areas of FACES if needed. But again, it is dependent on connectivity. Next. So how did we handle rollout? In April of 2014, 16 statewide super users were identified to participate in a pre-pilot and to assist with testing. They were all issued 4th generation iPads that were purchased and distributed. In June of 2014, we expanded the pilot to the 56 iPads were distributed to the identified pilot group. This meant of those super users, we gave iPads to the immediate units that they belonged to, so they could assist their coworkers with how to use the app themselves. Then in February, March of 2015, we did our first wave rollout statewide with 497 iPad Airs. And then in June and July, we issued 869 additional iPad Airs to the field. We're in the process now of doing our final order, which consists of about 140 iPads for remaining staff in which those positions were vacant at the time. Next. End user training and support. We identified what we called iPad mentors in each of our regions. These staff act as local experts and provide ongoing training with staff turnover. We have found that these iPad mentors have been absolutely critical. As we were traveling around deploying the iPads and training staff, these mentors would participate in all the training. They would even do some of the training themselves. Then as staff turnover happens and we get new employees in and iPads are reassigned, they are the ones to set up the iPad with the new worker, to sit there and train them on how to use the FACES app and the other do's and don'ts of the iPad. They've just been an absolute critical resource to us here in state office because we couldn't even begin to provide all that support ongoing statewide without their help. We did develop an online user guide for the FACES apps and the use of the forms that we developed for the iPad. Our FACES help desk did travel around the state for the initial deployment of the iPads, providing a walkthrough of the functionality and policy around use of the iPad. All of our information contained on the iPad is subject to Missouri Sunshine Law. That means that anything can be requested off the iPad, any documentation, any communications that are on there can be requested. Next. A little bit on device and data security. All the iPads use the standard iOS data protection feature that encrypts the data when the device is locked. Our MDM solution has the ability to remotely locate devices as long as they're online and wipe the device. During the process of downloading and uploading cases to the FACES app, all web services request the use of the HTTPS. And additionally, Missouri uses our per-app VPN. Requests are all inside a VPN tunnel. Next. All right, so to look at a first look at the data, which we're slowly starting to gather as we continue to get iPads out there to everybody in the field. Some of these numbers represent some improvements in the pilot project from July to December of 2014, after the initial iPads were distributed. We are working with the University of Missouri to conduct a survey of iPad users to look at satisfaction and job performance. We are also, again, in the process of completing a final order. Once all staff have their iPads, the university will begin looking at more outcomes in regards to our data. So you can see in those two charts, we looked at timely initial contact, and we looked at FCS monthly summaries and how staff are improving in terms of getting those in timely, having the tool out in the field. And I'll talk a bit more about that when I talk about the benefits, the other benefits we found of the iPad. Next. So going into the benefits of the iPad. First of all, they have full access to work email and calendar. This has been really great for the field. They can communicate with their supervisor. They can schedule appointments with families right when they're out in the field so they can see their calendar. FaceTime. They're using that to conduct visits with incarcerated parents, with siblings that are not located in the same county perhaps, or parents that can't get to a visit easily. As long as someone else on the other end has an Apple product as well, they can use FaceTime to conduct visits. We have instructed them that that does not take the place of their required month-to-month visit with the child. They're using instructional videos on YouTube. There's many, many instructional videos for anybody who's familiar with YouTube. Some of them are, for example, on how to remove lice. Some parents are very visual learners. It has been very helpful to them to be able to watch a video step by step rather than reading a pamphlet or a document. They've downloaded Microsoft Office for the iPad, so they're using Word and Excel. They're texting clients via the iPad. There's many free texting apps available that actually assign a separate number, phone number, for texting on the iPad so that staff don't have to give out their personal information anymore in their personal cell phones. Staff have reported that it's much easier to get a hold of their clients through texting than through calling. Clients will respond to a text much quicker than they will to a phone call or returning a voicemail message. Access to forms. We did develop about 18 forms for the iPad, and they're available to staff. They open them in Adobe, and they can capture electronic signatures, and then they will be able to soon. We're working on a document imaging project that will allow them to email that document to themselves, then upload it and attach it into our FACES system. They can access the social work field guide through the internet while they're out in the field so they can get questions answered or maybe research. Next. Photos. Our policy permits staff to take yearly photos of children in foster care. They're also permitted to take photos of objects during investigations, but not people. So this helps during the investigation process. They have found scanning apps where they can scan documents such as birth certificates, report cards, and such that they want to keep on record for a case. They're accessing other apps such as Best of Parenting and Recall Alerts so they can let parents know about information that would be helpful to them. I know a lot of staff are accessing the internet directly. They say it's incredibly helpful to them when they're visiting a parent if they want to refer them to resources, local resources such as food banks, clothing pantries, therapists. They can actually do an internet search right there on their iPad while they're with the family. And then a pocket prescription to help identify medications. These are all just some identified additional benefits that staff have told us about since they've had their iPad that went above and beyond the FACES app, which was the original purpose for purchasing the iPad. Next. Oh, a few more additional benefits are there is an app for a GenoNote and MindMeister that develops genograms, culturegrams, and ecomaps. They can use GPS for mapping and directions. And again, I talked about accessing the internet for direct services to families in the community. Next. No project goes without challenges and lessons learned. We did have to bridge the gap between business and technical, understanding each other's language and the benefits of the iPad beyond the Faces app. The Faces app was the sole focus of the project in the beginning, and our state IT staff did a wonderful job developing that. But again, we saw so many more benefits since we've started using them beyond the Faces app itself. Wi-Fi and VDI access to all the state offices. What we've learned is that not all of our state offices had Wi-Fi, and we really should have looked at that and rolled that out prior to the rollout of the iPads. But we are gradually getting Wi-Fi in all of our offices and rolling out staff to VDI. But in hindsight, if you're looking to do a project like this, that is something I would have liked to have addressed prior to the iPad rollout. Ongoing support, just needing both technical and business support for the staff using the iPads. They have a lot of questions. A lot of staff are not technically inclined. They don't even know how to turn on an iPad and do some of the basic functionality. So just having that support out there and the technical support that you need when they have problems with the Faces app or anything else with the iPad. Compatibility. Management between the Faces app and continuous Apple iOS updates. We've run into some challenges with that as Apple makes their iOS updates, ensuring that our Faces app continues to be compatible with those iOS updates. Staff turnover and reassignment process. We really had to scramble to put together a process on what to do when iPads are lost, stolen, staff leave, they need to be reassigned, because all of our iPads are configured for specific staff so that they can get their email and their calendar. So we had to come up with a process to make sure we could get all that done in a timely way. And then costs, ongoing and replacement of accessories. You would not believe how quickly cords get lost. Charge cords, car chargers. We did provide all of our staff not only with an iPad, but a portfolio that has a keyboard and obviously all the chargers, the iPad and the keyboard, and then a car charger. And those things do get lost. Staff leave the agency and don't return cords. And so you need to have costs available to replace those as needed. Next. So just some quotes about what mobility has brought to our caseworkers. They love the dictation talk-to-text feature. I didn't mention that earlier. They can review forms together and they can sign, clients can sign right on the iPad. They don't have to go back to the office to type their contacts. They like that they don't have to wait till they get back to the office to look up stuff a client might need. And then again, using the iPad app for entering their contacts, and it's helped them keep up on other areas of their job because they're up to date on entering all their contacts into Faces. Next. All right, I would like to turn it over at this time to Tomy for his portion of the presentation.
Great. Thanks, Leanne. Thank you so much. Hello, everyone. This is Tomy Abraham from Massachusetts. I will go over the post-implementation aspect of a mobile deployment program. The mobile devices that were deployed in Massachusetts was very similar to what Leanne described in her presentation. Just the numbers were slightly bigger. We deployed about 3,000 iPads, the keyboards, and all those. And we also had to deploy about 3,000 cell phones because the infrastructure was not available to make calls directly from iPad. So we just had to do that in this last financial year, ending June 2015. The use is primarily the case management system, the SACWIS Massachusetts SACWIS system, obviously corporate email, and approved mobile apps through the agency app store. Our MDM solution is AirWatch, and enterprise app store continues to have all kinds of application similar to what Leanne stated and some more as requested by our staff. After our deployment, we hired Accenture in winter of 2015 to do a survey and assessment, or post-implementation assessment, of the impacts of mobile devices in child welfare, Massachusetts. So Accenture did a survey of about 650 folks out of 2,400, because that was the number of iPads that was deployed at that time, and they interviewed about 60 workers, conducted focus groups in 4 offices, and also shadowed a whole day of 8 workers. So that was the exercise that they did for data collection. Could you move to the next slide, please? So the adoption, the data collected in early 2015 looks something like this. 92% of the devices are in use. So this was a completely optional program. We did not mandate that everyone has to use iPad, but people who opted out for various reasons have, many of them have opted in at the later stage after seeing the benefits that their coworkers are getting while using an iPad. In the survey also, 76% of the workforce indicated that they are very comfortable using a mobile device. We have a very young workforce in Massachusetts. That's possibly one of the reasons. 66% felt more efficient with it, and 87% of supervisors also felt that their workers are more effective with their iPads. Supervisors were not given iPads in the initial rollout, but because they're consistent and persistent in their need to have iPads for them, we did issue iPads to supervisors in mid-2015. Devices were used in multiple locations, 58% in car, 50% at home, and close to 50% at court, and certainly 36% in visits. This number must have increased because people, due to their own behavior patterns or cultural setup, some of them used, some of them did not use during the actual visit itself. Social workers obviously completed a range of tasks. Everyone checked emails. Recording case dictation was the biggest one. Using Siri in iPad certainly was a big help for people. They entered the time and attendance as well as child abuse investigation, 77%. So most of the case management system it's a web-based case management system. We did not do a mobile app, but that's what people accessed using an iPad. Next, please. Okay, so based on what Accenture has seen and what they have seen across the country from private and government sector, they put out some recommendations. What could happen, what could be improved. So this is something that you could look at some of the things in the following slides, and could be used as a map for post-rollout or pre-rollout guideline. First one is the practice transformation. Second is policy and organization. The third is technology and operations. Fourth, how to engage and support. Finally, the fifth one is how the culture and environment changes. In the following slides, I'll go over each of these 12 points rather than just listing them here. So let's move on to the next slide. Okay, so first is how to strengthen the strategic use of mobile technology. It is best to formalize and integrate mobile roadmap into agency operations. In Massachusetts, the agency leadership was very well on board with a program like that. Obviously, this all resulted from some horrific death of children. But regardless of their background of having a program like this, they were completely on board. That did help us to do it at such a fast pace. And we did institute some of the data collection metrics, and there is also a governance body for mobile devices. We track some of the key metrics every month and report the metrics itself about usage and other aspects of mobile devices to this governance group. And then we have a roadmap now to develop more applications on how to evolve mobile strategy. Second is the guidance on mobile integration with the business and case practice. This is a very critical one because if you must make sure that there is enough guidelines are developed and disseminated to the workforce while iPads are being or mobile devices are being used. We did not do much, and that caused confusion in the field, and which we try to remediate now, but the issues still remain because people ask questions, and there is not enough time to develop an answer for them, but we are continuing to do that. Next, please. Strengthen the mobile governance. So we do have a mobile subcommittee here to drive and update the implementation of roadmap. So, and there is also a secretariat-wide. So DCF, Department of Child Welfare, is only Children and Family is only one agency. There is a secretariat-wide governance model just for doing the mobile device management and administration. The fourth one is develop HR and administrative policies. If you do not have a telecommute policy in your state, please do so while doing the before doing the iPad or a mobile device deployment, because otherwise it creates inconsistent patterns of telecommuting from office to office, because it depends on the supervisor how they manage it. So it is always best to have a telecomute policy or other policies that are related to mobile devices, develop remote work, develop and disseminate. Determine a long-term funding approach, because most of these devices will only last for 2 to 3 years. So it is best to have, and we did spend capital dollars in getting the first set of devices, but it is imperative to have operational money available for the refresh of these devices as well as the upkeep of them. Operational dollars just for, as Leanne stated, for managing, for replacement of lost devices or repairs, plus to manage the refresh cycle. Next, please. Enhancements to agency app catalog. So, apart from mobile apps that people will be asking, one of the other things will be to make sure that people are going to work from outside. They do not need to come to office anymore. So there are multiple things that was really available in a facility-based computing model has to be made available to your users. For example, everybody had a shared public drive, which was a file server in an office. Now, unless you have a VPN, you will not be able to access those drives. What we are doing is we are moving our file storage into a cloud so that you do not need a file to access a file server in office. So rather than using the VPN model, Massachusetts is looking at a cloud-based model where directly through the internet itself you can access most of your digital assets. And that is true for testing, file management, and e-signature, etc. Then strengthening the underlying infrastructure and operational service support structure. We had to augment our help desk to support the mobility program, but also we have regular support engineers in offices had to be trained so that they could act as the first line of support, rather than every call coming to help desk and every iPad is being shipped for issues or repair. Second is reorient the technology infrastructure. So every office, it is best to have Wi-Fi's. Massachusetts, the advantage is it is a highly connected state, while signal strength is generally strong in most of the areas in state, but we still have dark pockets or dead zones inside offices. So you have to identify those offices and then Wi-Fi them. People certainly will ask for wireless printing because they do not like to use desktop once iPads are in place or mobile devices are in place. Next, please. Mobile-friendly business applications. So we have our SACWIS application. We did not take the path of mobile app. We would like to use the capability of HTML5-based browser applications as much as we can. So in this model, we are making our SACWIS application a responsive user interface model. And when you design your applications now, you'll have to look into the mobile device design into your design considerations, because now the users are going to have mobile devices which are having much less form factor, ranging from 4 inches to 10 inches. So your applications has to work, because otherwise productivity is much less. Refresh agency technology direction to incorporate mobile convergence of devices. Now every worker, at least in Massachusetts, has 3 devices and another 3 accessories that goes with it. One is a desktop, one is an iPad, one is a phone. So our aim is to see how a mobile device is the only device that they need to keep, and they could do all their technology functions right from that device. So unless we are hoping to achieve that I don't have a time frame, but that's what our strategy is, to make sure that there is only one device. And we are updating our agency refresh roadmap as well as application development based on that timeline. Next slide, please. Strengthen physical and virtual collaboration mechanisms for mobile users. So people, especially child welfare work or human services work, is a very stressful job. And child welfare workers come to their office for collaboration, for their peer support, and many things. What happens with the mobile device, an effective mobile device management program, is people do not have to come to office. So the collaboration becomes less. And we did not know what to do with this, but at least we are starting to put some tools out there, if not completely replace, at least to support a partial collaboration. So this is something that we are piloting now. Hopefully the entire state will be deployed by the end of December. This is a social intranet, and the next slide I'll show you what it does. It's primarily to show it's not just a top-down serving of static pages, but actually a collaboration setup similar with the social media aspect, similar to Facebook or one of those social media tools. This way, our hope is that workers can collaborate between themselves in a much agile way, rather than either picking up the phone or actually talking among themselves. The earlier results are very positive. People liked the offices. We piloted in 2 offices, and I'll talk a little bit in the next slide. Deliver more integrated training through devices. Our onboarding process has changed, so we give mobile devices to our workers in their second week. Now, it used to be that they were given files and files of big binders of training materials. Now it is given as a Dropbox link. They could access all that. We also put video-based training, as Leanne stated, in YouTube, or we have a learning management system where it could be accessed through iPad. So primarily, the classroom-based training is slightly being phased out in favor of e-training. The classroom training still happens for clinical subjects, but for technology training, it is happening. It has been drastically reduced. Next slide, please.
A screenshot of the department's new intranet is displayed.
So this is the new intranet. Unfortunately, I should have put one more slide which shows the social media aspect of it. But this slide, with this intranet, this kind of a product, you can actually do multiple things, such as just not the document management or content management, such as polls, blogs, chat, status posting, events, and anything that you do in a regular social media tool could be used inside a tool like this. And the people could collaborate, use as a group or a space or multiple mechanisms that are available in the tool for workers or their supervisors to collaborate, and they could do that. So I would be happy to provide an additional information on this if needed. But I think this is a newer aspect to increase and foster collaboration among social workers and supervisors. Next slide, please. The last one is strengthen internal communication. This is something that we lack with all the tools, even though I talked about multiple tools. We have mobile device coordinators in each office, and we conduct focus groups as and when time permits. But it is better to have a consistent mechanism for a feedback loop, as well as intra-office and intra-office communication regarding the use of mobile devices until it becomes a mainstream mechanism for people to do their work. And we are on our way to be there, but not yet. So those are the 12 points that we thought will be helpful to folks if you are planning to deploy mobile devices at a large scale to your workforce. And the last slide, I can show you how. Yeah. So there are three aspects to mobility. The first one being the agency itself, second one being secretariat, third one being at a state level. So there could be, and each of them will have separate functions. It doesn't have to be mutually exclusive, but it could be. So as you can see in this slide, there's a governance center, there's a service center, and innovation center.
A chart appears on screen listing responsibilities for 3 mobility centers of excellence. Responsibilities for the Mobile Governance Center include policy, standards guidelines, audit, certify, and enforce, security, MDM/MAM, advice, education, and training, network and infrastructure. Responsibilities for the Mobile Service Center include liaison to the business on their app dev needs and requirements, oversee app development and maintenance, oversee app vetting and testing, provide end-user support, measure mobile against KPIs. Responsibilities for the Mobile Innovation Center include innovator, driving enterprise mobile agenda for state, funding and authority to define mobile strategy and development priorities and investment sequencing.
Each of them wants the policy, standards, and guidelines, security, MDM, MAM, etc. The second one is the service center for app needs and oversee app development and actually doing the testing and vetting. The third one is the actual innovation center, where it drives innovation of mobility strategy itself. So it doesn't have to. Massachusetts is only starting here. It's nowhere near to what is shown here, but over the years, we hope it could be there if there is enough financial as well as management support. So that is the Massachusetts lessons for a mobile deployment. Thank you, Joyce. Thanks, everyone. Joyce, you could take it.
Yes, absolutely a huge thank you to Leanne and Tomy, and what a fabulous presentation. And I think there is probably a lot of interest here. So and hopefully questions. So may we please open the phone lines or the chat to our webinar's attendees for the question and answer session with our presenters. And Elizabeth, I'm going to let you run this.
Okay, perfect. So if I could have our operator just instruct us again on how people can line up on the phone for questions.
Thank Thank you. At this time, if you'd like to ask a question, please press *1, and please record your name when prompted. Again, to ask a question, please press *1.
Okay. I also wanted to let you know several of you have asked about the availability of the slide presentation. We'll be emailing that out as a PDF after the presentation today. Usually they go out in advance, but we had a few technical difficulties trying to get that email out. So I will be sending the slides out. And at the very end of today's webinar, we also will show you the link where the recorded webinars and the materials are made available on the Children's Bureau website. So if you've enjoyed today's presentation and you think some of your colleagues could benefit from watching it, it will also be available as a recorded webinar. We do have several questions that have come in online, so I'll go ahead and put these out to the group while we're waiting for people to call in on the phone. First question is for Leanne. How come Missouri can't take photos of people with iPads?
Well, that is actually a law enforcement requirement. Our law enforcement during hotline investigations, they are the ones who do photographs of any injuries that may be needed during a court case, but our policy says that we have to leave that up to law enforcement.
Got it. So it's not a technical restriction, it's a legal one.
Correct, yes.
Okay, perfect. Next question, is Missouri's FACES system the same as DC's FACES?
No, it is not. We built our FACES system in-house. It is not a cost system.
Just a popular acronym then.
Yes.
Massachusetts, did you provide mobile keyboards?
Yes, we did.
Okay.
And just be very diligent in selecting one because some people like it, some people don't. But we did provide mobile keyboards.
Okay. There are quite a few questions coming in online, so I'll just pause and see if we have anyone on the phone.
Yes, we have a question from Diane Mobley. Your line is open.
Yes, this is Diane Mobley. I'm with the Mississippi DHS. What was your connectivity back to your office? Was that through Citrix or some other line of upload? How did you do the upload back?
And who is the question for?
Either state, it doesn't matter.
For Missouri, the connection, it's a VPN connection through Cisco not Cisco AnyCon. It's through the Mobile Device Management Solution, Mobile Iron. They provide a per-app VPN feature, and that is how the data is routed back to the internal servers of the state.
Is that Mobile Iron, is that a Cisco product?
No, I'm sorry. The Cisco, I was thinking about something different. That's what we use for our normal VPN. For this app, the Mobile Iron solution, that's what manages all of our devices, allows us to track them, wipe them. It is similar to what Massachusetts is using. His slide said it was AirWatch. In fact, we're actually looking to move to AirWatch from Mobile Iron. They're doing a proof of concept on that.
Okay. And so Massachusetts, you're using AirWatch?
We use AirWatch to manage the devices. So when you have a large number of devices, you need a software to manage them. So that is the use of AirWatch. The connectivity is we have Verizon is our cellular provider, our data provider, and we allow only internet-based applications in iPad. So there is no connectivity directly to Office itself. All applications are exposed through internet, direct public internet. So there is no need of a VPN.
Okay, this Mobile Iron solution, is that just controlling your devices, or is that actually controlling also your upload, the information that they've gathered?
Both. It does manage the devices, and one of the additional features of it is this VPN, and then it is configured to automatically route all traffic from our application through the VPN tunnel.
It's a secure tunnel so that all of our data is secure out there when we're entering into the app and then downloading it back to our main servers.
Okay, that's one thing to know. But this AirWatch, does that do the same thing, or?
Yeah, it's all those are all the softwares that work in the same domain. Their primary function is device management, but they certainly give additional add-on functions such as the tunneling, document management, content management, and things of that nature. Yes, they are all similar products.
Okay.
This is Joyce, and I think for clarity, Missouri uses a virtual private network, and Massachusetts uses a public. Is that correct?
Massachusetts uses public internet. Yes. Joyce, you were muted at the second half of the sentence. That's why I just completed it.
Okay.
Thank you.
Public internet, but how are you securing that?
The information will be, the connection is through HTTPS. So when in motion, the data, when it gets transported, is through secure channel.
Okay. All right. Thank you.
No problem.
Sure. Okay, do we have anyone else on the phone?
And once again, as a reminder, if you'd like to ask a question, please press *1. Please record your name when prompted. And please check the mute feature on your phone before recording your name. And I have no questions at this time.
Okay, well, we have quite a few that have come in through the chat feature. So what electronic document management system do you have in the back end where these mobile devices feed documents into?
In Massachusetts, it's a Documentum-based EDM, Electronic Document Management System. Documentum is the infrastructure, and we have integrated Documentum through a web service into our SACWIS. So when you take a photograph or scan a document, you can directly upload into the case management system. But to specifically answer the question, Documentum is the document management infrastructure.
Okay. Leanne, did you have anything?
Well, no. Missouri, we're actually in the process of working on a document imaging project, so we don't have that feature as of yet.
Okay, perfect. Oh, this is a fun question. What were the ballpark costs of implementing the Faces mobile application?
I should have had that ready. Ballpark cost. I think we were looking at, and we had a line item, we had a legislative line item to purchase our iPads, and I want to say we were looking at the initial cost to purchase the iPads that we have now is about $1.5 million, a ballpark. But then you have to add on to that. We have, all of our iPads do have data plans through varying data providers like AT&T and US Cellular and Verizon. So we have ongoing monthly data plan costs as well. And I would say, I think I've heard that in the ballpark of $15,000 to $20,000 a month, maybe.
Okay. All right. And a similar question: what was the cost? Well, what was the cost, and what was the duration for both mobility projects?
I can speak for. Go ahead, Leanne. Sorry.
No, you go ahead, Tomy.
So in Massachusetts, in phase 1, we equipped all social workers with the mobile device. That's about 2,000 mobile devices were rolled out in 2 weeks. But the total end-to-end, that is procurement RFQ out to the devices in users' hands, it was probably about 60 days.
Okay. Has it been an issue with users needing to record data on mobile devices that they did not pre-plan and download the case when they had Wi-Fi?
I'm sorry, could you repeat that?
The question was, has there been an issue with users needing to basically access a case that they don't, before, you said they had to be in a place where they had Wi-Fi to download the case. Have there been issues where they've forgotten to do that or haven't been able to do that and then find they need to record and they no longer have Wi-Fi where they are?
Sure. I mean, yeah, we've had that situation. Certainly, you can pull into McDonald's and find Wi-Fi. Again, all of our iPads do have cell packages, so if they can get a cell signal, they can download a case at any time. They just have to have Wi-Fi or a cell signal to download a case. But again, some of our really rural areas don't have that as readily available to them. So they need to be as conscientious as possible to download their cases before they leave the office. or when they're in an area where they can get Wi-Fi or a cell signal. But if they find they don't have it, they certainly have other options, like the iPad has a notes feature. A lot of them have downloaded Microsoft Word, so they can take notes in Microsoft Word on their iPad. That's outside of our app, but they can take notes and then cut and paste back into it later if they need to.
Okay. So we had a similar question asking about how you've rectified some of the the problems in rural areas, and it sounds like your response answered that. Tommy, I don't know if you have anything to add. I don't know if there's issues in rural areas in Massachusetts or not so much.
There are some dead zones in Massachusetts also, but our solution, we do not have an offline disconnected mode computing a mobile app, so we couldn't do much about our case management system. Obviously, the email will work because you can it will work without it'll download the emails. So people were out of luck, to be clear, with their case management system when they are in a dead zone. We couldn't do anything.
Leanne, did I cut you off? I thought maybe you started to say something.
No, I was just going to clarify that, yes, our solution for the rural areas was being able to work offline. As long as they have the case downloaded to the app, they can enter contacts, they can do safety assessments, visitations, those 4 areas identified during the PowerPoint, and save the data as much as they want, and then worry about syncing it up later once they're back in some kind of range of some kind of connectivity.
Okay.
So that's been really critical for our rural areas.
All right. And related to that, when they download the case to the iPad, is the case locked to anyone else in the office?
So we had this discussion from an IT perspective. It was a concern. The decision was based on the way our caseworkers work. It's not really necessary. There should not be anybody touching a case other than that caseworker. So there's nothing technically locking that case so that somebody doesn't come in and edit it behind the scenes and cause problems.
So I guess what you were asking is if I download it to my iPad and are working out in the field, if a coworker is also working that same case at the office. Because I've downloaded to the iPad, it's not locked for anybody else to touch it.
Mm-hmm. That's how I understand the question from what came in.
We do not have that feature, but we are just, as Jimmy pointed out, I think we're hoping that, nobody will be doing that. Can't say it won't happen, though.
Okay, and I just want to check in with the operator. Do we have anybody on the telephone with questions?
I show no questions.
Okay, we have a few more that have come in online. Do you worry about people leaving case note data in Word if it's not getting uploaded into a database?
There certainly is that concern. The iPad, though, does lock and, is password protected and everything's encrypted on the iPad when it does lock. And we do have the MDM solution to wipe the iPads remotely if we ever need to, if they're lost or stolen. We prefer them to do it through the app, secure app, because that's just one other layer of security. No, not at this time.
Okay. And again, I'm getting several questions online regarding the presentation, so I just wanted to remind you all again that we will be emailing copies of the slides after today's presentation, and the recorded webinar will also be made available on the Children's Bureau website. And as we close out today's presentation, we will show you the link to where you can access all of our previously recorded webinars. So another question we have is, can you disable the app using AirWatch if an employee, say, leaves the organization or the device is lost?
Yes, AirWatch does provide those kind of capabilities. You can lock the device, you can wipe the device, you can something called bricking the device. So it's just nobody can. If you have specifically for iPads, if you enable the Find My iPhone iPad feature, you could just make the device completely wiped away. And we we do that occasionally because people do report lost or stolen devices at least once or twice a month. That's what our data is. And what we immediately do is we remove our application links from the device and lock the device. And after a couple of, probably a day or something, we wipe the device off.
Missouri has the same features. Like, again, Mobile Iron and AirWatch are doing pretty much the exact same thing, just different vendors. We have the ability to lock them or wipe them remotely, as long as they have a network connection of some sort to receive the wipe command.
And then we have a question, and it's for both states, I guess, or for whoever cares to answer, but what carrier are you using?
Cell carrier? Or
yes. That's how I understand the question.
Well, in Missouri, it just kind of depends. We have majority of our carriers, AT&T. We do have some pockets of the state that we use Verizon, and we're now actually expanding into U.S. Cellular in some of our eastern parts of our state. But those are the primary three.
Okay, and whoever asked that question, if that doesn't answer it, let us know. Go ahead, Tommy.
It's Massachusetts. It's only Verizon. Verizon has the best reception across the state, so that was an easy pick for us.
Okay. Do we have any questions on the phone?
Yes, our first question comes from Diane Mobley. Your line is open.
Hi. This is Diane Mobley. I'm with Mississippi DHS. I have a couple more questions. When you download the case to the iPad, are you only doing the ones that you listed, the safety assessment, visitation contacts, and participation? Or are you downloading the demographics and everything about the case? How much of the case are you downloading, or do they have a choice of what they need to download?
No. When we're downloading the case, it's really just the shell demographics, enough to be able to answer the information needed for safety assessment, visitation, household members, parents, kids, that information. No, we didn't want to download the entire case to the app because it's not needed per se to just enter a safety assessment. We wanted them to have what they needed to be able to go out in the field and complete that safety assessment or enter a visit that they're supervising at the park.
Okay, that sounds good. All right, one more question. Video. Is your workers doing any kind of video recording of the sessions that they're doing? And if so, are they uploading that to the case?
Well, we don't have the ability right now to upload and attach photos or videos to our FACES system right now. We're working on a project of that nature. But they are using the iPad to show videos or do videos depending on the need. I know a lot of our resource workers who license foster homes, they use the iPad to show videos that as part of their training of our prospective foster and relative homes.
She's asking more about recording video. Is your question more about recording videos of the interactions?
Yes. Yes.
And they can record videos of the interactions, yes.
But we don't have a place for them to upload those.
Upload and attach it to FACES, no.
Okay. So
We
that's
do.
something they put in their files. Okay.
In Massachusetts, you can upload any kind of content. We just put a restriction on the size of it. We are working with the company to store the videos because video management itself has to be done carefully. We do not want people to download 1 GB of video through an iPad. So we do allow video and any kind of electronic content as long as it is less than the size that we tell them.
Okay. All right. Thank you. That's all I have.
All right. Just a reminder, if anyone would like to submit additional questions through the chat feature, please go ahead and do so. And for our operator, do we have anyone else on the line to ask a question through the phone?
Yes, the next question comes from Paulette.
Hi, this is Paulette Sally with South Carolina. My first question is for both states. If you could tell me the size of your development team, and then my second question is Missouri. Why did you choose to develop it in-house?
Okay. Tommy, why don't you go first?
Sure. We have the total number of folks who are working on this, including developers and business analysts, is about 20. At any time, it's 18 to 20 people. As I said, we did not develop a mobile app. We just made our regular SACWIS application a responsive user interface, and we do that in-house only because it just wasn't working for us to do it as a turnkey solution provider contract, because our business is not agile enough to meet the deadlines of a vendor. So we are in our experience, this works out better than having a vendor doing the entire thing.
Okay, so for Missouri, the development team, well, I was mainly one person with probably 3 backups. It did take a lot longer because it was such a limited team, but because it was developed in-house and we had no background knowledge of doing this. I mean, it started off as a proof of concept. Can we even do this? And then it evolved. So it was hard for us to bring in too many resources to work on it because every day you're learning and moving forward kind of piece by piece. So the development team was actually very small. But because of that, it took longer. If you had somebody who was already familiar with a lot of this, you could have more people, you could do it a lot faster. The reason for doing it in-house instead of a vendor, I can't speak from the business perspective, but from the IT perspective and my outlook on it, even if you buy a product, you have to do some sort of integration into your existing system. And that is where you'll spend the bulk of your time, is the integration. So the way we did ours, we actually used a lot of the underlying code as web services, and we called the same code that they would use from the Faces application itself on their desktop, and we just used the same code from the mobile application. So that lowers the development. We didn't have to do a whole lot of back-end work. All we had to do was the front-end work of creating the iPad app. But we have looked at some solutions from vendors, and that's, from an IT perspective, always the concern is you can buy you don't have to develop the app, and it's got some middle layer in there as well, but at some point you have to integrate back to your original system or replace your original system. And that's where you're going to spend most of your time. And so we just thought it was easier to go ahead and develop it in-house.
I mean, this was a new thing for Missouri. We didn't have anything like this in the state. And I think the IT wanted to take the opportunity to explore because there were lots of other divisions and departments wanting to go in this direction. So they took this opportunity to really be the groundwork for the rest of the state to
prove that we can do this internally. Yeah. We don't have to contract it out. Since then, not related to the Children's Division work, but other agencies within the state have hired vendors to write applications, one of which in particular is an internal application for state staff. And I've been brought in to help them on that project a little bit, and we're paying a vendor, I can't imagine how much money, and we're having a lot of problems with them. It is not going very smoothly. So, and some of that may be vendor selection. Maybe we just got a bad apple. But
So I hope that answered your question.
Yes, it did. Thank you very much.
Mm-hmm.
So I have a question that's come in online, which is how many days of training were needed to in the field, and do you have an ongoing trainer?
Well, for Missouri, we actually, on our initial rollout, we did, it was not even a day. It was a couple hours training. We'd hand out the iPad. We'd help them get it set up because there was some initial setup that had to be done. So we'd walk through the setup together, and then we would do a presentation that would talk about the app. We would train, show them the app, train them on how to use it, and then we'd talk about the other features of the iPad, the do's and the don'ts, stressing that anything they download, we do in Missouri tell them that they can download free apps from the App Store that are work-related only. And, stressing that 100 times over, that you can't have Netflix and movies and Candy Crush. So our training was less than a day. And we have our iPad mentors do our ongoing training as new staff rolls over.
In Massachusetts, the training is about 2 hours or less than that. Most of the workers did not need even that because once this, Leanne said, once the email setup is over, a lot of them had iPads already, so they were okay with less than 2 hours of training. We do our regular SACWIS training when we do a release. We do our trainings, and that trainings happen directly on iPads. And that depends on what was the content that we are releasing, nothing to do with iPad per se. So that's the Massachusetts experience.
Do we have any other questions on the phone?
Yes, the next question comes from Mita. Your line is open.
Hi. We have a question. I think it's both for Missouri and Massachusetts. How many average number of hours have you saved for your workers before the mobile application versus after the application is implemented?
I mean, for Missouri, I really can't give you a number at this point. We're still issuing iPads, and we're working with the University of Missouri to start collecting that data. I know we've been collecting some raw data, but actually making some sense of it. We're still getting all the iPads out there and everybody trained.
Okay.
It's a good question, and I should be careful in answering it. Rather than the time, we look at two things. One is the travel expenses saved, so that people do not have to come to office to input the data. They could do it wherever they are. And that we see some significant savings. And also, there is a compliance with the entry of home visits, and that has also improved. And I should say possibly about 10 to 15% of improvement in the compliance itself. We don't have an actual consistent number on the travel savings, so probably we should wait for a year to say this is what was saved in travel expenses, and that is what we probably will look at as savings from it, not necessarily hours per se.
Okay, thank you.
No problem.
Okay. Do we have any other questions on the phone?
I show no further questions. And again, as a reminder, if you'd like to ask a question, please press star 1.
Okay. I don't have any other questions online, so we'll just give another couple seconds in case anyone wants to hop on the phone. And Tomy, I just wanted to point out one of the things I really appreciated that you brought out today. I think mobile technologies are wonderful and obviously producing some really solid benefits in states, but I really liked that you called out the potential loss of collaboration and needing to think about that and thinking about ways to replace that because it's critical when you have people in sort of the same space together and working together, that collaboration flows very differently than it does when people aren't needing to come into the office anymore. So I really particularly appreciated that you brought that out today. I think it's a really important point.
Thank you. Yeah, so that, removing children, especially children and infants from a home is not even unpleasant. It's a very stressful experience. And we in Massachusetts take secondary trauma of workers very seriously. And I do not want to claim that having a social intranet will resolve it, but at least we do whatever we can.
Absolutely, yeah. It's a source of support. I just heard another speaker in a different setting talking about secondary trauma to workers and how workers provide formal and informal supports to one another. And she said, you walk into the office and you hear laughter in the break room, that's not people goofing off. That's people providing support to one another. And
Absolutely.
You lose that when there's no one there to laugh with you in the break room or whatever. So I think that was an excellent point. Do we have any other callers on the line at this point?
I show no further questions.
Okay, then Joyce, I'm going to go ahead and turn it over to you and let you wrap it up for us for the day.
Okay, but guess what? I have a question.
Okay, then.
Surprise. So I heard both Leanne and Tomy, I think, say that their caseworkers are texting between themselves and a parent or a family member or child, perhaps. And my assumption is that those texts are much like emails and that they are part of the official record. I guess I'm curious as to how those texts are captured and entered into the official record using iPads.
I can talk about Massachusetts. We do not. The only thing that we tell users is you do not use personally identifiable information, PHI, PII, as well as any information that is pertained to the case itself. This is primarily used as not necessary for a case-related communication, but just as your, how do I say that? Something that you can just collaborate, but not even collaborate, just for a preliminary communication with our consumers. So we actually reuse phones as well as iPads, obviously. But when the phones come back, we wipe the phone out before reissuing the phones to another worker.
Okay. Thank you. Leanne, do you have a comment?
Yeah, right now there's no way to take the actual texts that they are doing on the iPad and making those actual texts as part of the case record. I think for the most part I can agree with Tomy that they're using it for very basic, hey, reminder, I'll be out there at 3 today for a home visit, or, quick kind of conversations, just confirming things. But we do encourage staff that, anything beyond that needs to be recorded in our system as a contact. So they would have to separately record it as a contact.
Okay. Thank you for explaining that. And I have one more question, and it actually is to Leanne. And you spoke about having iPad mentors as you were starting your mobile product.
Yes.
Joyce, you've cut out on us, so we can't hear the rest of your question.
Okay. How many iPad mentors do you currently have? And then what is the criteria that you use to select those mentors?
Okay. I would say we have about 20 to 25 statewide. We do allow our regional directors. Our state is divided into 5 regions, and we allow our regional directors to select the staff that they feel are best suited for that position. Generally, they've been our higher level staff that aren't case carrying, our specialists, our our QI managers and QA managers, who are primarily responsible for assisting staff regularly. They look at data, they look at outcomes, they help staff on a regular basis make sure that they're getting data entered correctly. So we don't know the staff in those areas, so again, we let the regional directors pick the person they feel has the best skill set to be that type of mentor.
Great. Thank you, Leanne. So let's move. We are about out of time, so let's move to our conclusion. And once again, I just want to thank Leanne and Tomy most excellent presentation, as evidenced by the many questions and the number of attendees. So we hope that the information shared with you today was both informative and valuable. As a reminder, please remember to register for the December webinar once the announcement is released. Additionally, if you have any questions regarding today's topic, would like more information about any of our scheduled webinars, or would like to volunteer your state as a topic presenter, please do not hesitate to contact me at the email listed above.
Joyce can be reached via email at joyce@kassets.com. Recorded versions of the webinars are available at https://www.acf.hhs.gov/cb/research-data-hyphen-technology/state-hyphen-tribal-hyphen-info-hyphen-systems/training.
So, this webinar has been recorded and will be made available online. When it is complete and posted, we will send a message via the SACWIS Manager listserv with the link. Once again, thank you for attending. Once again, thank you to our presenters. And that is it for today. Thank you very much. Goodbye.